So coming into the lab, we always have to make sure we are wearing our appropriate attire, our PPEs, our personal protective equipment. First and foremost is your lab coat. We always have a designated space for our lab coats. We must put them on and button them all the way down. And this is to protect both our clothing and our cells, because in the event of a spillage, especially in histology, it could be very detrimental. The next thing we must do is we must wear gloves. And according to your size, you don't want your gloves too loose or too tight. The way to put on your gloves, pull it up all the way, make sure that they fit appropriately. Again, not too big, not too small. And we don the other one. Some people prefer to wear aprons. It is quite all right to wear an apron depending on the job that they're going to be doing. You tie it in the back and it's good to go. The other safety feature is your goggles. If you wear glasses already and they're not reading glasses, you can leave those on and they can serve as a protective layer. If you do not wear glasses or you want to put a pair of goggles over, you can put a pair of goggles over your glasses. But this is safety for your eyes because some of the chemicals do splash and we always want to make sure that our eyes are protected. Again, these are just some of the PPEs depending accordingly to your job or your task you'll be doing for the day. This is what we would put on. So removing your safety gear once you have done the task that you need to do, obviously your safety glasses will come off. You can clean them off with some alcohol. Make sure you wipe everything off of them. You would put them away. If you're wearing an apron, we would throw it in a receptacle. If it's got biohazard, if it's been put through some blood or it's got blood on it, please don't throw it in the regular trash. It would go into the biohazard trash.
So here we have our biohazard container. In the histology lab, we deal with a lot of bloodborne pathogens. Of course, most of those are excess tissue, anything with fluids, any neutralizing pads. The formalin is neutralized before it's disposed of, and that's actually something that's measured. And here we have a sharps container. This would be for used slides or scaffolds, disposable scaffolds that we use in the grossing area, as well as blades, both from the microtome and cryostat.
This one is nice and still clean, so we can put it in the regular trash. To take off your gloves, gloves are something that people don't necessarily remember how to do it. There is a proper way to do it. You take one glove off, you take it from the bottom and you pull all the way up. Then you hold it in the hand where the other glove is. You don't touch it. You come and you pull the glove off. And now both gloves are inside out and you dispose of them, especially if they have blood or any other biohazard in a biohazard bag. If, again, they've only been through things that are not, then you can put them in the regular trash, but most of the time, these will go in your biohazard bags. Then your lab coat, we will take it off, unbutton it, take it off, make sure that it's clean. If it is clean, you can reuse it, but a lot of labs prefer that you don't. Here in the classroom, we will hang it up, has our initials on it, and it's good to go for the next day. Thank you.